If you wake up with a dry mouth, a dull headache, or that heavy, sticky feeling, it is easy to assume you just forgot to drink enough water. But here is the twist. A lot of morning dehydration is not about how much water you drank yesterday. It is about what happened while you were asleep. Overnight, you lose water through breathing, sweating, and normal kidney function. And if your air is dry, you snore, you ate salty food late, or you had a hard workout, that loss can be bigger than you think. So the goal is not to chug a huge bottle the second you wake up. The goal is to understand the drivers, then use a simple routine that replaces fluid at a steady pace with the right amount of electrolytes and without upsetting your stomach. We are going to walk through the most common causes, the signals your body is actually sending, and a practical morning hydration routine you can repeat every day without overthinking it. Moving to slide 2. First, let's define what you are feeling. Morning dehydration is usually a mix of two things. One is low total body water. The other is a shift in electrolytes, mainly sodium, that changes how water sits inside and outside your cells. That is why you can drink a lot of plain water and still wake up feeling off. If you are low on sodium from heavy sweating, or you are high on sodium from a salty dinner, your thirst and fluid balance can feel weird either way. A simple way to think about it is this. Hydration is not just a tank you fill. It is a distribution system. Your body is constantly moving water where it needs to go, and electrolytes are the traffic signals. So when you wake up dry, we want to ask two questions. Did I lose more water than usual overnight? And did I wake up with an electrolyte mismatch that makes water less effective? Moving to slide 3. Now, how do you tell if this is actually dehydration and not just grogginess or bad sleep? Look for clusters, not one symptom. Common signs include dark yellow urine on the first bathroom trip, strong thirst that does not fade after a few sips, dry lips, and a mild headache that improves after you drink. Some people also notice a higher morning heart rate or feeling lightheaded when they stand up quickly. But there are lookalikes. If you wake up with a headache every day, that can also be sleep quality, caffeine timing, teeth grinding, or even your pillow and neck position. If you wake up dizzy often, that can be blood pressure changes or other issues. So use this as a practical check. If your symptoms reliably improve within 30 to 60 minutes of steady drinking, dehydration is likely part of the picture. If they do not change, it is worth looking beyond hydration too. Moving to slide 4. Cause number 1 is mouth breathing, snoring, and dry air. When you breathe through your mouth, you evaporate more moisture. Add a dry bedroom, and you can wake up feeling like you slept in a desert. A quick self-check is simple. Do you wake up with a dry tongue, sore throat, or crusty lips, even if you drank fine the day before? Do you notice you breathe through your mouth when you exercise lightly, or when you are congested? What helps is not just drinking more. It is reducing the overnight loss. A humidifier can raise room humidity. Even a small change can reduce dryness. Nasal breathing support matters too, like clearing congestion or talking with a clinician if you suspect sleep apnea. And one more thing. If you keep water by the bed, take small sips if you wake up, but avoid turning it into a full drink session that disrupts sleep with extra bathroom trips. Moving to slide 5. Cause number 2 is late-day sodium, and it goes both directions. A very salty dinner can pull water into your gut and bloodstream, increase thirst, and make you wake up thirsty. But very low sodium, especially if you sweat a lot and only replace with plain water, can also leave you feeling weak and dried out in the morning. So, think about your last meal. Was it restaurant food, packaged snacks, sauces, or cured foods? Those are sodium dense. Or was it a long sweaty day where you drank a lot of water but barely ate? What you do with this information is simple. If you know dinner was salty, aim for steady water intake in the evening, not a huge late chug. If you sweat heavily, consider adding electrolytes at some point after the workout or with dinner, so you are not trying to fix everything at 7 a.m. The goal is balance, not extreme restriction. Moving to slide 6. Cause number 3 is caffeine and diuretic timing. Caffeine can increase urine output in some people, especially if you are not used to it or you take a large dose late. But the bigger issue is often behavioral. Caffeine replaces water. You get busy, you forget to drink, and you arrive at bedtime already behind. Also, some pre-workouts and energy drinks combine caffeine with other stimulants that can increase sweat and raise breathing rate. More loss, less replacement. A practical approach is to set a hydration anchor before caffeine. Drink a glass of water first, then have your coffee. If you love coffee, keep it. Just do not let it be the first and only fluid for hours. And if you notice you wake up thirsty after an afternoon caffeine habit, try moving that last caffeinated drink earlier. Not because caffeine is evil, but because sleep and hydration interact in both directions. Moving to slide 7. Cause number 4 is evening exercise, heat exposure, or just a high sweat day. If you train after work, you can lose a surprising amount of fluid and sodium. Then go to sleep before you fully replace it. Here is the tricky part. If you try to fix that with a huge amount of water right before bed, you might sleep worse, because you wake up to pee. So you feel tired and you also feel dehydrated. Double hit. A better pattern is front-loading replacement. After a sweaty session, start rehydrating right away. Sip steadily for the next couple of hours. Include some sodium, either through food or an electrolyte drink. Then taper fluids in the last hour before bed so sleep stays intact. If you want a simple metric, weigh yourself before and after a hard workout sometimes. A drop in body weight is mostly fluid loss. It is not perfect, but it teaches you how much you personally lose. Moving to slide 8. Cause number 5 is what you ate and when you ate it. Carbohydrates store with water in the body, and when you eat fewer carbs than usual, you can lose more water. On the other hand, a very heavy late meal can increase overnight water needs for digestion and can also affect sleep quality. Fiber is another one. If you increase fiber quickly, your gut holds more water. That is not bad. It is just a reason you might feel thirstier, especially in the morning. And then there is sugar. Very sweet desserts late can increase thirst for some people. Again, not moral judgment, just physiology. So, if your morning dehydration comes and goes, look at the pattern. Did it happen after a low-carb day? After a big late meal? After a sudden fiber increase? Once you spot the trigger, you can adjust with small changes, like moving dinner earlier or adding a bit more fluid with the meal. Moving to slide 9. Before we build a routine, we need one safety guardrail. More water is not automatically better. If you drink huge amounts quickly, you can dilute sodium too much, and you can feel nauseous, headachy, or just off. Most people are not at risk from normal drinking. But the point is pacing and context. If you are sweating heavily, you need water and sodium together. If you are not sweating, you probably do not need aggressive electrolyte dosing. Also, thirst is useful data. It is not an enemy. If you are thirsty in the morning, respond to it. Just do it steadily. A few big gulps, then a pause. Let your stomach empty. Let your body catch up. And if you have medical conditions that affect fluid balance, like kidney disease or heart failure, hydration routines should be personalized with a clinician. Now, with that in mind, here is a simple routine that works for most people. Moving to slide 10. Step 1 of the routine is what you do in the first 5 minutes after waking. Keep it boring and repeatable. Drink 300 to 500 milliliters of water. That is about 1 to 2 standard glasses. Not ice cold if that bothers your stomach. Room temperature is fine. Then pause. Give it 10 minutes while you do whatever your morning looks like. Bathroom, shower, getting dressed. This pause matters because it prevents that sloshy feeling, and it improves absorption. If you wake up very thirsty or your mouth is dry from mouth breathing, you can add a tiny pinch of salt to that first glass or use a low-sugar electrolyte mix. We are not trying to make it taste like the ocean. We are adding a small amount of sodium to help fluid retention. And if you wake up with reflux, start smaller. A few sips every minute for 5 minutes can be easier than one big drink. Moving to slide 11. Step 2 is the 30-minute window. This is where most people accidentally sabotage hydration. They drink 1 glass, then immediately switch to coffee. Then they get pulled into work. Instead, aim to finish another 300 to 500 milliliters over the next half hour. Not all at once. A few mouthfuls every 5 minutes is enough. Now add a decision point. If you exercised hard the day before, if you sweat a lot at night, or if your urine is very dark, use electrolytes in this window. If none of those apply, plain water is fine. Also, pair fluids with a small breakfast, or at least a few bites of food if you tolerate it. Food slows the flow a bit and can reduce that straight-through feeling where you pee out everything quickly. And keep an eye on your thirst. If your thirst drops and your mouth feels normal, you are on track. Moving to slide 12. Step 3 is building a simple electrolyte rule you can actually follow. Because the internet turned electrolytes into a personality trait. Here is a grounded approach. Use electrolytes when you have higher losses, heavy sweating, long workouts, hot environments, diarrhea, or a very low-carb phase where you are losing more water. In those cases, sodium helps you hold on to the fluid you drink. On normal low-sweat days, you can usually get enough sodium from food. If you add electrolytes anyway, keep the dose modest and watch how you feel. A practical sign you might need more sodium is when you drink water and it feels like it goes right through you and you stay thirsty. A sign you might not need more is puffy fingers or feeling overly bloated after salty drinks. So, electrolytes are a tool, not a daily requirement for everyone. Moving to slide 13. Step 4 is the part almost nobody talks about. Your hydration routine starts the night before. 2 hours before bed, do a quick check. Have you had at least a few decent drinks of water through the day? Did you sweat? Was dinner salty? If you are behind, start sipping then, not at midnight. In the last hour before bed, taper. You can still take small sips, but avoid large volumes that force you to wake up to pee. Sleep fragmentation makes morning dehydration feel worse, even if your total water intake was fine. Also, consider the room. If the air is very dry, raising humidity can reduce water loss through breathing. If you suspect mouth breathing or snoring, it is worth addressing, because it is a direct overnight drain. So the night strategy is steady hydration early, then protect sleep late. Moving to slide 14. Let's troubleshoot fast with a few common scenarios. Scenario 1. You wake up thirsty every day, with dry mouth and sore throat. Think dry air and mouth breathing first. Hydration helps, but reducing overnight loss is the real fix. Scenario 2. You wake up puffy, thirsty, and you had restaurant food late. That is often sodium plus late fluids. The move is earlier hydration and a less salty dinner, not a morning water marathon. Scenario 3. You wake up with a headache after a hard workout. That can be fluid plus sodium debt. Use electrolytes after training and in the first 30 minutes after waking. Scenario 4. You wake up and pee is very clear, but you still feel thirsty. That can happen if you drank a lot of plain water and diluted sodium. In that case, a modest electrolyte dose with breakfast may help. If you want one simple tracking method, rate your morning thirst from 1 to 10 for a week, and note dinner, workouts, and room humidity. Moving to slide 15. Let's wrap this into a simple plan you can remember. Every morning, do 2 glasses in 2 phases. Phase 1, right after waking, 300 to 500 milliliters, then a 10-minute pause. Phase 2, another 300 to 500 milliliters over the next half hour. Use electrolytes only when the context fits. Heavy sweat, heat, dark urine, or that persistent thirst that does not respond to plain water. Otherwise, water and normal meals are usually enough. And fix the upstream causes. Dry room, mouth breathing, late salty dinners, late caffeine, late workouts without replacement. If you want to keep it really simple, pick one lever to change for 7 days. Just one. Humidity, dinner salt, or the 2-phase morning water routine. One quick question for you. Do you wake up more thirsty after a salty dinner or after a workout day? Comment A for salty dinner, B for workout day. If you want more practical routines like this, subscribe. This information is not a substitute for medical advice. Health span first. Lifespan follows.